rare diseases are a cluster of many different diseases that might number only a few hundred or a few thousand patients across Europe. They're individually rare, but collectively not so rare. If you look at the rare diseases, they may number hundreds of different diseases, but with very small patient populations. And they do have very broad impact because, as I say, these diseases typically are poorly treated and often have very poor outcomes for people at a young and otherwise very productive stage in their lives.
Rare disease patients through the years have been more or less neglected or subject to discrimination or inequalities. And one of these factors is because if you have a very limited number of patients, just a few patients in a member state, there is not enough capacity, neither administrative nor financial, to invest in research, and then multinational cooperation is definitely needed.
You might have in any one country perhaps 10, 20, 30 patients. That's not enough to run a full development program, a program where you can really define with confidence the efficacy and safety of drugs. So you have to run these programs across multiple countries. Then when you start to run into the challenges of differing legislation at the different country levels, you start to reach or result in operational challenges. Europe has a fantastic history in terms of science and drug development, but to be honest, in terms of competitiveness at the moment, I'm not sure that Europe is where it can be. And I think a couple of the current bits of legislation that are in development have tremendous possibilities to really improve these outcomes.
In the Horizon 2020, there is a financial portfolio which is envisaging research and innovation in this area to be funded with EU money. And for us in the Parliament, the main concern is not to decrease the percentage of this money envisaged to invest in public health research. The two directives on the clinical trials and price transparency, so-called Price Transparency Directive, they could be used, but just partially. The main issue is that the organization and the financing of the healthcare system is a subsidiarity, or it's a national competence. And still we do not have in the treaty health as an EU competence, and that's why we end up with a clear evidence of inequalities, but then we do not have much opportunities to intervene.
I think there's a great opportunity for industry and academia and the government to speak in a common voice in terms of how we gain access to these innovative therapies to patients as rapidly as possible.
We have prepared lots of legislation on all kinds of harmonization of happy chicken, pigs, etc. But I would like to see more happy people across Europe.